Hi, I'm Rachel Solotaroff, the President and CEO here at Central City Concern, where we're ending homelessness through evidence-based, comprehensive solutions that help people reach their highest potential. I first walked in the doors of CCC in 2006 when I was working as a research fellow at Oregon Health and Science University. Though I'm trained as a physician and a researcher, I have always been most fascinated by the power of community, to take care of its own, to harness the power of listening, connection, innovation, and yes, scientific evidence to make things better for those who are most impacted. And after my first day at CCC, I knew that this was the place where that could happen. I'd like to tell you why. For the past 42 years, CCC has been laser-focused on one key question. What are the best practices to end homelessness, to help those individuals who are struggling with life's biggest problems to build lives that are healthy, housed, resilient, and engaged? And to do this, we listen. We co-create with those with lived experience. We innovate and study. Often, when people think of homelessness, they focus on individual choices. But when we look at the data, what we see are actually two major factors: individual experiences and structural causes that interact and amplify one another to drive people into homelessness. So what the science shows is that if you address these structural factors and combine them with services to support individuals, you can not only change the trajectory of a person's life, but you can reshape systems and their outcomes. For instance, we now know that when we combine supportive housing with addiction treatment and peer support, we can improve people's completion of their treatment, improve their engagement with primary care, and drive down total healthcare costs. We know that when we combine employment services with rent assistance, people are more likely to complete their employment program, more likely to obtain career track employment, and less likely to need rent assistance in the future. We know that culturally specific services produce better and more lasting outcomes for people of color than traditional services. If we apply our best evidence and our best emerging practices to the populations that benefit from them, and if we do this at scale, we can and will end homelessness. The crisis of homelessness requires solutions that take its complexity into account, with the compassion needed to support our neighbors as they find home, regain health, and move towards stability. This is the work that CCC engages in every day, the work the Portland community has trusted us to do since 1979. We're profoundly grateful for that and for your belief in us today. Thank you.